Hi, this is Dr. Greg Doerr for Functional Soft Tissue, and we're going to do our second video for the condition of the month for April, which is going to be SI joint dysfunction or laxities. And in this case, we're going to be doing FAKTR concept number 2, which is motion. And in this situation, we're going to have our patient doing flexion extension at the hip, which is going to help generate motion at the sacroiliac joint, at the same time allow us to treat the low back, the abdominals, the gluteal tissue, as well as the hip flexors. Now, in this situation, our patient's actually wearing leggings, which makes it easy for us to treat directly over the clothing. However, if we're noticing that we're not getting our desired results, it's always better to be instrument or hand directly on the skin. For the purpose of our video, obviously, we're going to keep clothing on, and we're going to do a generating of motion through flexion and extension while treating through the gluteal tissue. And we're going to have our patient start. The important thing to understand is you want to make sure you treat through the entire gluteal tissue, because of the different fascial layers that occur here. And the simple truth of the matter is while we may say we're on a piriformis or on the glute medius or minimus, these tissues are very, very deep. So the chances that we're actually getting directly on them is probably not 100% accurate. That doesn't mean that we're not affecting the tissue through neurologic mechanisms and helping to reset the tone of the tissues as we describe in the science associated with FAKTR. We also want to make sure that we move through the low back. And if we want to get a little deeper towards that QL, we can use a finger to get a depth of penetration and then just sit in there with our instrument. We can come anteriorly towards the TFL. We also want to make sure that usually the point of pain associated with this is going to be right around that PSIS. We want to make sure we spend a little time there because this is a massive attachment of both the lumbar erectors, all the gluteal fascia, the thoracolumbar fascia, as well as the dorsal sacral ligaments associated with the sacroiliac joint. And then from there, we can move along the iliac crest and come to the front. Now, we can do this in a couple of different ways. We can treat through that sacroiliac joint and the hip flexor by getting a depth of penetration with our fingers and then using the instrument to just kind of follow the depth of the fingers. For treating the anterior fascia associated with the sacroiliac joint, I shouldn't say the sacroiliac joint, the hip flexor. However, let's demonstrate something using non-instruments using FAKTR concept 2 of motion, and we're going to use our fingers for a hip flexor maneuver. So what we can have our patient do is we're going to find that depth of penetration that we want to be at. I'm going to come right along that iliac crest, get my fingers into the iliacus as best I possibly can, as deep as I possibly can. And we're going to have our patient move very slowly here. We're going to come all the way to a flex posture, and then she's going to slowly extend. We don't want her to move too quickly here because that'll get a little bit more uncomfortable. And come on back up. And with each stroke, we can go a little deeper depending on what our patient will tolerate. And we're just going to do one more. And relax. Now, it's also important to understand that we want to treat through the abdominal region here. We do have the low back, the glutes, the hip flexors, which we've already demonstrated. An important thing to understand is you never just treat one side of the sacroiliac joint in the pelvis. With SI joint problems, we understand that these are two ends of a seesaw. If one's going posterior, the other one's going anterior. What you'll frequently see is the glute on one side will be more dysfunctional or more uncomfortable for a patient, and the opposite hip flexor will be in the same fashion. It'll be more dysfunctional or more uncomfortable. So we want to make sure we treat both sides. After doing this type of treatment associated with the glutes, the hip flexors, we like to do, especially with unstable, or I should say lax sacroiliac joints, these may be our patients who have had pregnancies or multiple children, is we frequently can do a muscle energy. And what we can do with that muscle energy is actually use our patient's own muscles to reset the pelvic joint. Frequently, manipulation of the sacroiliac joint in a laxity is going to be more painful than actually beneficial. So in this case, from the instance of the camera, we're going to assume that our patient has, again, a left posterior ilium. She's going to lie on her left side on the table again. Now our muscle energy technique, we're going to use on that left side, we're going to assume that's posterior. So we're going to use our quad and our hip flexors to pull that pelvis forward. And on the up side, which is going to be our anterior side, we're going to use glute max and hamstring to pull the pelvis backwards. So this is going to be our squeeze. And we're just going to go right in between our patient's legs. She is going to push down with a straight leg against my thigh, and with a straight leg, she's going to push forward on the downside leg. And I'll have the patient on a count of 3 squeeze, 1, 2, 3 squeeze. And we just let her crush and then relax. And a count of 3, 1, 2, 3 squeeze. And we can give a little overpressure while she's squeezing, keep squeezing, push, 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 push. And we can give a little extra overpressure and relax. And then we can do that one more time. 1, 2, 3 squeeze. And a little overpressure again. And relax. Now, once we do this, we can do the supine to sit test again to make sure that the legs have evened out. However, if the patient comes to a standing position, we can reproduce the lumbar ranges of motion that were painful before. So on our first video when we did history and diagnosis, the patient had pain on extension and lateral flexion, so we can have the patient just extend again, and then laterally flex again. And these motions should have gotten better associated with our soft tissue treatment and our muscle energy. SI joint problems in particular, usually getting rid of the symptoms isn't a problem. The patient will get right up off the table and notice a change massively as soon as you've done your soft tissue work. However, when they're a little bit more unstable, it's a challenge of keeping them away. Frequently they can get in and out of the car and have a regression rather quickly just with that change of position again. This is only a short-lived situation. Whether SI joint problems are stable or a little bit more unstable, they all respond. The only difference is the amount of time you may have to treat them. So for functional soft tissue, I'm Dr. Gregory Doerr. This is video 2 for FAKTR treatment, and today we used concept 2, which is motion associated with sacroiliac joint rotations, and I look forward to seeing you at a class soon.